Hey, good morning, wherever you're joining us from. This is Dr. Duni TV. Hope you have a pleasant night. Yesterday, we talked about AS genotype, the risks that are involved, why one should go ahead to get married to AS. All right. Now, the thing is, yes, a lot of people asked question about, oh, doctor, what is CVS? Is that something that has to do with heart? Well, in genetic testing, a CVS is one of those investigations that you can actually use as a diagnostic means to know the genetic makeup of a baby that's inside the uterus. Okay, these are cases when people who are AS get married together and they want to take a necessary step to know the genetic makeup of that baby the wife is carrying. And again, the essence of it is that it will actually tell you if the sickle cell, if the AX trait is found in that patient, or if the sickle cell disease is also found in the patient. That's when they come down with the SS, and why the trait they come out with AS. All right. Also, there are other means where people can also do amniocentesis. This is also one of those investigations you can do. But I want to tell you, AS woman getting married to AS man, like we said yesterday, is not an unknown criteria because of some technological means now that are coming up, that where people are beginning to go extra mile to do what they want to do. But if you ask, it's not actually advisable. Why? Because there are tendency that 25% of this couple, 25% of people who are having AS who get married, there are possible that they may have an AS trait, while 25% is also attributed to the SS sickle cell disease, why the 50% goes for the AA. All right. So because when you look above, you will see appropriately how the diagram goes. This is how the offspring of this family are going to look. So at the end, if you know the risks, why would you want to do that? Why would you want to do? Yes, we know that love supersedes everything, but irrespective of how it is, you must take a precautive measure, because the risks that are associated with a sickle cell disease will so much affect your lifestyle. It will cause financial meltdown for you. You will be seen often in the hospital, most especially when you give birth to one of those sickle cell disease that is known as SS. All right. Every time when they are exposed to cold weather, they want to break down. When they, a lot of things they don't want to. Cold triggers it. When they have malaria, they are down. You see their appearance. Sometimes they feel low self-esteem. When they come out in the public, they're like, oh God, why did my parents bring me to this world? Why am I different from other people? Because they are always falling ill. All right. So irrespective of how it is, in you asking about the CVS, yes, quite all right. What is done is, when the baby is in, a small probe will be passed into the woman's uterus, and a little placenta will be picked for a genetic analysis. They will now analyze it to know the genetic makeup of this. Well, this is for the academic purpose for people who are in medical line. But you that are not in medical line, I want to tell you, if you must want to marry AS, both of you want to marry, be ready, because it's really, really, really financial consuming, right? You must spend money. Is it about the IVF, where the egg of the woman and the sperm of the man will now be, they will now carry out a process during the IVF procedure to make sure they know the genetic makeup of the likely offspring they are going to introduce into your wife. Those are cumbersome. They are very expensive, and this procedure that you will done to make sure that it's not is SS trait is very expensive. It's even above 10 million. So would you want to do that? So please, I want to tell you, I want to encourage you. You should, as a matter of fact, know your genotype before you say you do to anything. Have a lovely day. Bye. Dr. Duni TV loves you.